Yeah.
Let's get it.
All right. Hey, welcome to Iron Revival's Kettlebell Corner. I'm Jeremiah Whalen here with Roger Parks, and our guest today is Zac Cupples, the creator of the Human Matrix course, hip hop aficionado, and all around good dude. Zac, tell us a little bit about yourself, and then we'll kick off into the intense line of questioning we have for you.
Well, you said all the important things, but yeah, my name is Zac Cupples. I'm a physical therapist, strength coach, and I wear two major hats work-wise, which when you're bald like me and Raj, you got to wear hats sometimes, especially when you live in sunny places like Las Vegas, like I do. First thing is I run the website ZachCupples.com, where we produce a lot of content about all things movement, biomechanics, and what have you. I teach the seminar Human Matrix, which is a movement-based seminar where basically the problem that we're trying to solve is creating a unified movement theory that transcends all the systems, because a lot of systems say, well, you know, we're kind of saying the same thing as this group versus the other. What is that same thing? We answer it there, and then we teach you how to build your movement capabilities from essentially the ground up, whether you're on the rehab side or training side. And then I also offer a lot of remote services there, movement consultations where we can help you increase your mobility, training, mentoring. And then I also work at Elevate Sports Performance and Healthcare in wonderful Las Vegas, Nevada, as a physical therapist and education director. And that's pretty much my life at this point.
That's a lot of stuff.
Fascinating.
Yeah.
Before we get going, I do want to point something out. I think it's important for people to get that. One, we've been to the Human Matrix. We've taken the course, getting ready to take it again in December, just because there's so much good stuff there. These concepts really do work, not just with clients, but I've worked with Zac personally. I came to him. I had some issues with my left shoulder. One of my goals was to be able to press the 40-kilo kettlebell again. Couldn't do that. I was about at a 24 with pain. Last I checked, I've got 8 reps with the 40. These concepts work. They are quick. They're efficient. They're not just, it's not always just, roll around on the floor, don't work, don't exercise. It's pretty high level stuff. It's pretty effective. I generally like to avoid being enthusiastic, positive, or saying nice things about other people, but I don't really have a choice in this scenario. So really want to get to the point that this stuff really does work. Pay attention, check this stuff out. It works. First question, I guess something that will probably underpin a lot of our conversations. We have, with your system, we've got these 2 archetypes. Can you explain a bit about what those are, and can you explain what you might see or look for with these 2 archetypes, and really what, if you look at my body versus Jeremiah's, I'm a narrow, he's a wide. We've got very different body types. How do you think those are going to show up with our kettlebell skills, longevity, all of that good stuff?
Yeah. So this concept definitely, I don't think, is anything foreign to what we know already in the industry, because we essentially have people grouped down into body types. If you're familiar with ectomorph, mesomorph, endomorph, this is a way that we can look at those and appreciate those from a biomechanics perspective, and also have something objective to measure along with that. And so what I look at is the infrasternal angle. And so basically all that is it's a measure of the shape of the inner portion of your lower rib cage. So if you got the sternum, which is the hard part, right on the front of your chest, if you dip just below that, when it gets a little rubbery, that's your xiphoid process. And then we're essentially looking at either side of just below that, not the bottom part of the rib cage, but that centerpiece. And it seems as though, at least based on some of the concepts that, because this has been talked about with Shirley Sarman, this is talked about, like there's this book called Body Mechanics and Human Disease. It was like 1930. So they were kind of looking at these concepts for a long time. But you basically have people who have a more narrow infrasternal angle, or the lines are more vertical. So that would be you, Raj. You'll also other populations that might be more predisposed to having this And I would be talking about it like people who are probably good or built for certain activities. You're looking at endurance runners. You're looking at gymnasts. You're looking at really good people who can rotate. So sometimes higher level golfers will present with this population, especially if you notice a golfer who has a more vertical based backswing. All of those, strong likelihood that they will be more narrow infrasternal angle individuals. And that's just based on the way that their rib cage is built is going to predispose them to be better at certain activities. The other one, Jeremiah, would be a wide infrasternal angle. So these would be an angle that would be closer to horizontal, so less vertical. Those folks might actually be better predisposed for more kettlebell-based activities because that is a shape that is generally, not always, generally better at force production. It's a more stable position because it's a wider base of support. So power lifters, more strength-based athletes, some of your elite performers in various sports. So if you kind of think like the V-shape position that people will have, that's where these folks reside. But they might not be as good of rotators as, say, someone who's a narrow because of the shape. Also, like a lot of your bodybuilders, so the people who have a really wide rib cage, they have the physical structure to support a lot more muscle mass. And those are the big two archetypes. And a common mistake people think when they kind of delve into this is, okay, I'm narrow. I just need to try to make myself wider so then I have more balanced movement, and then vice versa for a wide. And that's not what we're talking about, because this is the way you're built. It's Lady Gaga, baby. You were born this way. And so we it's just understanding that we're built differently from each other. We need a measure to tell us how exactly we're built differently. And then based on that build and the way other areas of the body are often biomechanically influenced, we can predict that certain people are going to be potentially predisposed to having movement limitations based on their body structure, and others may have different movement limitations. But then again, in the case of kettlebell training, and this is kind of something we talked about off air, the degree of compensatory activity that someone may need to develop to perform well at a sport, a lot of times you might see both of those archetypes meet in the middle. And so that's really all that we're looking at and measuring with these infrasternal angles.
So as far as, we've got most, we're talking specific to hardstyle kettlebells here. So there are usually about 6 basic skills. There are others, but 6 basics that we talk about. So if we get into your swings, your cleans, your snatches, your presses, your squats, and your get-ups, where might we see some of the differentiation between these two archetypes? So for example, what am I likely to be better at, Jeremiah, and vice versa, just based on how we're built?
So the big thing is you have to look at what biomechanics at the pelvis, because most of the hardstyle based kettlebell activities is definitely lower body focus. Even with your snatch or anything of that nature, you still have to do some type of hinge based activity to get in position more often than not. And so we have to look at which of these two archetypes has a body type that makes hinging easier. And to understand that, we have to look at, well, what has to happen to the pelvis in order to create an effective hinge? And so with that, you have 2 different positions that you have available in terms of pelvic dynamics. And we're looking at the sacroiliac joint. Now, I want to preface, there's only about 2 degrees of motion at the SI joint. You're going to see me demonstrate extreme ranges of motion with this model. So just take that into consideration. But what we also have to consider with this is that even though I'm demonstrating extreme ranges of motion, we're still getting contractile changes in portions of the pelvic floor, because that's essentially what allows my sacrum to either tip forward, which is nutation, or tip backward, which is counter nutation. And based on the archetypes that we talked about, a wide infrasternal angle, Jeremiah, is going to have a predisposition towards having more of a nutated sacrum. And the reason why that is is based on the rib cage structure. There's going to be certain portions of the thoracic diaphragm that are going to create a downward push of the viscera, your guts, and the goods in a certain way. And that's going to, the pelvic floor is going to have to change its shape to accommodate that. And so based on that, the nutated or tipped forward sacrum is what we're going to see with someone who's wide. And in fact, when I nutate the sacrum, the back side of the pelvic floor is going to be more opened up or stretched or eccentric. So there's going to be more space available to move in that open area. And that means your pelvis is going to be tending towards moving more posteriorly in that particular situation, which is hinging. So based on Jeremiah's build, someone who's got a wider rib cage, the more horizontally shaped rib cage is likely, not always, but likely going to be better at hinging. Conversely, someone who's a narrow infrasternal angle, Raj, with a gray haircut like my boy, that is going to have more of a tip back and counter-nutated sacrum. And so in this situation, the backside of the pelvis is more contracted, or the pelvic floor, I should say. So it's harder to move into a hinge-based position because you have to be able to get those tissues to relax, and it's you have a bias towards not that. But you might be better at squatting because that's the position that we'd like to see with a more vertical-based squat. So a lot of your anterior loaded-based squats, front squat, two kettlebell squat, goblet squat, Zercher, whatever. That's the positioning that we want to see. And so just based on structure alone, someone who's got a wider rib cage would generally, not always, but generally be better at more hinge-based exercises, which is foundational with a lot of hardstyle-based activities. The other thing would be that a lot of the hardstyle-based activities are very emphasizing generating a large amount of tension, which is also something that, based on the structure of these individuals, people with wider rib cages are generally predisposed to being better at generating tension, whereas a narrow generally predisposed towards being more flexible. But that doesn't mean that, you measure your rib cage, you're like, crap, well, I guess kettlebell's out, let's go do bar classes. No, that's not what we're talking about here, because you can still have people, because both of you are very good with kettlebells, even though you're built differently. And in fact, Pavel, the father of hardstyle, he's a narrow ISA and he moves horrendously well. It's like very good. So you can still have people who can adapt to a particular sport. It's just the way that the path that Roger may take to get to doing well with this particular craft is going to be different than the way Jeremiah is going to get there. Jeremiah might have an easier time. Roger, you might have to do different strategies to be able to essentially reach the same path.
Well, it does show up in some of my, my warm up, some of my maintenance, but I have actually altered, and because of these concepts, when I teach people, I'm aware of natural biases. And if I've got someone who's narrow or with myself, I don't try to go into this really excessive kind of tabletop hinge. One, I know my ISA doesn't handle it well. Two, my torso to leg length ratio is also going to make that difficult for me. So rather than trying to push the issue and getting into that dogmatic, it's got to be this super deep hinge, I understand that I'm going to have more forward knee. I understand that I'm better at squatting. So if you look at a lot of my ballistics, rather than trying to push the issue and get this deep hinge, I get as deep as I'm comfortable, but I'm going to have a little bit more of a vertical trajectory. I don't have back issues. I don't have a lot of the other stuff that a lot of kettlebell people will have, because they're trying to, really basically push this square peg into the round hole. So understanding your ISA has been really critical in terms of allowing me to understand what my form needs in order to be successful over the long term. So really, really, really cool concepts, really, really important.
Yeah, and it's good that you've cultivated awareness in that, because I think that's the square peg round hole syndrome is an issue we see in all types of sports. You see it in golf. People want to try to achieve a certain swing. You'll see it in, really any technical based sport. And the sooner you can recognize that just based on someone's build, they might not be able to attain a position. The more likely you are to develop either workarounds or be able to structure someone's program and the way they move in a manner that's best suited for their bodies, because then you're still going to get a good output, and you're likely going to mitigate any potential injury risk from trying to get someone to do something that they might not be able to.
Awesome.
Yeah, that makes a ton of sense. So one's not better than the other. They're just different. Is that right? I mean, I shouldn't be sitting here thinking, boy, oh boy, if that narrow ISA came my way, Christmas would be better this year. You know, it's just different, right?
Yeah. Yeah. It's literally just different. There's trade-offs for each.
Right. And let's kind of talk about the kettlebell swing then. If we're looking at the kettlebell swing and people are in their position for swinging, sometimes, you know, you're going to see one leg or two legs kind of move in and out. You know, what is something that might be excessive rotation outward externally, or what are some reasons why this may happen based on some of the things you just covered?
Yeah. So we have to look at then, okay, if I know that when I do a hinge or a swing, my hips have to move posteriorly to some degree, has to happen. And we also know, based on what I just talked about with the dynamics of the pelvis, that's going to be associated with a more nutated or forward tip sacrum. We then have to look at how that position impacts the rotational action that should be happening at the hips. And so when I nutate the sacrum, the acetabulum, which is the hole that your femur sits in, is going to be pointing more inward, which is going to predispose someone towards being able to have more internal rotation. And so if you're doing any type of hinge-based activity and you have a fairly narrow stance, you need to have X amount of internal rotation in order to complete that task without cheating. And so if you're seeing someone who pushes the knees out a fair amount when they're doing that hinge-based activity, that could be because they lack an appropriate amount of internal rotation. And so what they're doing is they're trying to find a workaround for that. So you basically have two options. If you can't produce the internal rotation at the hip, your body's either going to have to change the orientation somehow to fake more internal rotation, or you're going to avoid it. Those are really the only two options. And so I'll give you a very quick example. So if you take your arm out to the side, go ahead and do this, folks. And I just want you to go ahead and see how much internal rotation you have at your shoulder. So kind of pointing down. Okay. Now I'm going to show you a quick way that you can pick up a fair amount of internal rotation without changing anything at your humerus. You ready?
Ready.
Crunch. And it'll look like you gained about 30 degrees or so, right? Awesome.
Yeah.
Cool. Slouch. No.
That's how we roll.
Yeah, right. So what you did in that case, in order to pick up the internal rotation, was you tipped your thorax forward. That changed the orientation of the glenoid, which is the hole that the humerus goes up and connects to. And it allows you to get more internal rotation. But it comes at a cost. The cost is now you've locked, and I use that in scare quotes, but you basically have not required as much range of motion to be expressed at the glenohumeral joint. And you've put the humerus, the scapula, and the thorax basically all as one unit to get there. And so now with a swing, what would that look like? If someone gets a huge arch in their back and the pelvis tips forward, it's the same thing. That's a way someone can pick up internal rotation without being able to express it at the hip joint. Now, if you got someone who pushes the knees out, that's them avoiding the internal rotation. So they're externally rotating the femurs, so that way they don't have to get in as much internal rotation. It's the same reason why someone might choose a sumo deadlift over a conventional deadlift. So as if you're a power lifter, you've been lifting weights for a long time, you get tighter as an adaptation to be able to lift heavy weights. and now you can't do a conventional deadlift anymore. So, well, okay, I don't have much more motion. Wow, when I put my knees, or when I widen my stance, it's way more comfortable and I can get a lower depth. Well, the reason why is because you've now reduced the internal rotation demands by moving the feet out. And that person who has a tendency to push the knees way out when they hinge is doing a similar action.
So eventually we're going to probably lose some variability. We're probably going to compromise the ability to do something else, or at least get out of that position if we're just maintaining that compensatory strategy. I mean, because, you do swings, it's common to do, hundreds of swings in a with all of your movements in a single workout. So it's a lot of repetition there.
Yeah. Well, and not only that, but you're also choosing an activity where you have to generate a lot of tension in order to complete the task. And so anytime I'm creating a lot of tension, I'm inherently reducing space. So you can look at it as like, if I have this tube of toothpaste right here, right? And we'll say this is a joint, right? So if I squeeze a certain part of the joint, the space in that part of the toothpaste tube or the joint is going to get smaller. And then I have where the toothpaste now is, that part of the joint space has gotten larger. Well, if I have a sport like kettlebells, hardstyle, where I need to create tension throughout the range, well, that's kind of like squeezing the toothpaste tube all around or creating tension on all sides of the joint. And so that inherently is going to restrict movement locally at the joint. And then if you do that enough over time, the tissues adapt. So you're able to do that better. That will come with a cost. And that cost is going to be, I have less range of motion available. And that might be a useful adaptation for the swing. But then the problem with that is, well, now you're distributing the workload over a smaller space that could potentially predispose you to overloading certain tissues, and either you might be experiencing pain or injury, and that's not to say that doing hardstyle kettlebell is a good or bad thing, right? It's just, this is what you want, this is what you're going to get. If you don't lift weights, then or do anything, well, then that's going to come with costs as well. You might have good movement, but you might stay single like me. So
time to hit those weights there, Zach.
I haven't. We have
a kettlebell club every Wednesday and Saturday. We're happy to have you.
You know what? I have this love-hate relationship with the swing, because if I don't do it for a long time and I go to do it, like, I will feel my hamstrings ripping apart with each swing. I will have DOMs. And then that's going to last 5 days. And then I'm like, I'm never doing that again. And so then I stop, and it's just this vicious cycle.
I'm going to have to check you out in December. I'm going to have to see these swings in action.
Yeah, maybe you're just like torturing yourself, though. And you're like, let me just get those DOMs again. Let me get them. That happens.
Yeah.
So I want to talk about rotation. I've got something I've been wondering about. So you have some conventional hardstyle wisdom, which is keep everything square, keep everything stiff. We don't want any rotation. I depart from that pretty frequently. One, based on body type. Two, motion needs to come from somewhere, and there are very few bodies who can actually swing a kettlebell and stay mostly square. It really, I think, comes down to width of the shoulder, length of the legs. There are a lot of anthropometric variables. But I tend to rotate more through my upper body. If I'm doing a unilateral skill, I'll rotate through my upper body, because it makes more sense to rotate, from my T-spine versus, have one knee dipping in and out, et cetera. But I guess the question really comes down to degree. So with each unilateral skill, with each movement in general, your joints are rotating. We don't have these sagittal hinge joints the way most people think. That's something you talk a lot about. If you are utilizing some rotation, do you think that's enough with kettlebells, or do you think that most people ought to supplement with either, maybe doing stance, like a split stance, swing, snatch, or getting in other planes entirely, kettlebell sport? Do you think most folks are likely to need some sort of rotational supplement to maintain just some baseline function? Or do unilateral skills offer enough rotation?
I think the answer to that question is going to be person dependent. And the only way that you'll know is you need to find some type of key performance indicator that's meaningful to you and associated with health. So for someone, that could be, hey, let's see if you can do a full ass to grass squat, and not have any compensations getting on the way down. For some people, it could be a toe touch. For some people, it could be an aptly scratch. And so you monitor, you find whatever is meaningful for you, and maybe you find someone who's versed in some of these movement assessments to kind of give you an idea of what that is. And then you monitor that over time, and you look at your training over time, and you see what changes. So conceivably, there could be some people who maybe they just do some rotational based stuff within some of their kettlebell work, and that's enough. There could be some people who need more than that too. There could be some people who maybe they need to train the hard style less frequently in order to stay healthy, but they're still able to maintain their skills and force production. So I don't think there's necessarily a one size fits all answer to that. And it's more experimenting with your own body to see what works best for you. And I can only speak off my biased population. If I have someone who's pursuing a sport, whether it's powerlifting, whether it's hardstyle kettlebell, or anything where tension has to be created to a high degree, I try to pepper as many things that go contra to that as I can in order to preserve that person's health. But that doesn't mean that there aren't people who exist who don't need that.
Okay, that's reasonable. Next question is about a common cue with hardstyle pressing. It's really common. You'll hear people say, press with your lat, press with your lat. It's always been a problematic cue. A lot of articles written about it. A lot of people trying to defend it. There seem to be some anatomical contradictions there. Your lat, when it shortens, obviously does pretty much the exact opposite of what your shoulder needs to do when you press. I think there's a lot of maybe some stability of the lat. Can you tell me what you think about that when you hear that as a cue? What are the things that start turning through your head with that cue?
So Raj, I actually have never heard that cue before.
Okay.
Can you explain what it should look like visually when you see someone pressing with a lat?
So this is the inherent problem, and why I ask you this question, because it's one of those things that gets defended. The best defense I've ever heard was in a book. I think it was called Perfecting Your Press. And the idea basically, I think, is the lat should perform as a stable base. Okay, it should be the base for the scap. It should be the base for the connection of the upper and the lower body. So there should be a co-contraction with the lat as the arm is going overhead. What gives me pause is, one, I think it's somewhere around 40%, somewhere around there. Some people have a direct scapular attachment to the lat. So you've got that lat contracting, yet you need upward rotation to get overhead. You start to run into some trouble. And I think part of the reason why I asked you is it never really made much sense to me as a cue. And people talk about the idea of not pressing from the hand, which makes a lot of sense. Or for me, one of the things I think is, when you look at the anatomy, you've got the lat, you've got serratus anterior running basically directly underneath, which is a very powerful upward rotator, which makes a lot of sense. You got to get that scap to rotate overhead if you need to go overhead. But I guess the thing I run into very commonly with other kettlebell coaches is they don't upwardly rotate when they press. So I can usually put a kettlebell or two on somebody's press if it's a coach, just because they're not upwardly rotating and they think they've got to keep that whole packed position.
Okay. Well, so it sounds like this cue is similar to when someone says pack the shoulder when you do a press.
Very similar, yeah.
Yeah. So I would agree with you on that front. If I'm going to go overhead, the scapula has to upwardly rotate to some extent. It's not until about 60 degrees of shoulder flexion that the scapula starts actually moving and upwardly rotating. But from there beyond, it is upwardly rotating as much as humanly possible. And it has to do that so you reduce pressure buildup on the superior aspect of the glenohumeral joint where the rotator cuff sits. And so we want a scapula that's mobile and free. Now, are you going to have the scapula get to the point where the humerus is maximally externally rotated at the top? No. All right. Because you're moving heavy weight, chances are most people are kind of going out to the side, which is going to create more of an internal rotation action as you go overhead. But I definitely would want to see that scapula moving when we're doing these types of press. It has to. And if you restrict that, I think that's going to be problematic. Now, that said, if you're using the lat to almost tip the thorax posteriorly, which we saw that a lot when, like if you look at like really old Olympic lifting stuff, when overhead press was actually a thing in the Olympic lifts, well, almost everyone who did that tipped their thorax backwards in order to get the weight to go overhead. And essentially what that does is it's the reverse scenario that we talked about when I had you measure your shoulder IR and then slouch. Well, if I know I need to go overhead, I know I need a certain amount of external rotation at the humerus in order to make that happen. Because if you have true shoulder flexion, you're going to have at least 60 degrees of external rotation occurring at the humerus at the top. And so what if you're someone who doesn't have that? Well, what you could do is you could tip yourself backwards, because now that changes the orientation of the glenoid to give you the appearance that you have more ER available. And then in that situation, you might be able to press overhead more so than if you kept more your torso stacked. So if you're using the lat to get that as a workaround, I could see that being justified. But there's no free lunches. There's a cost to doing that, and the cost would be you are going to be starting to lock more pieces of your body as one, and that doesn't allow you to distribute the workload as effectively as you could if you had more movement expression across multiple joints. But either way, you do need the scapula to move as you're pressing overhead, and if you don't do that, then there's probably either going to be a force production restriction, a range of motion restriction, or you could potentially compromise tissues within the shoulder girdle in a negative manner.
So as long as we're getting some scapular upper rotation, the shoulder can still stay seated. We're not going into a shrug, but we don't need to. As long as we're getting some of that, keeping that shoulder, we can still keep the shoulder down. We're good to go. We're going to be completely safe, allowing that scapula to move, not keeping everything packed.
Yeah, well, and let's not get it twisted. A shoulder shrug is not the same as scapular upward rotation. Usually a shoulder shrug is going to happen, well, if I have some type of rotator cuff injury, that's a common compensatory strategy to try to get the arm overhead. And that you'd have to get medically evaluated if you're seeing that. But typically you're not going to be able to go very far overhead, if at all, if you have that going on. But the other thing would be if I have more of that slouch-based posture, and in my world that would be entailed with I have a difficult time getting the anterior or the front of the rib cage to expand and move effectively. Well, when I do that, muscles that would elevate both the clavicle and the scapula, so your levator and your upper trapezius, those have more leverage to be able to contract. And not only that, but that position also will limit the amount of upward rotation that's available. So we might see that as a compensatory strategy, but the issue isn't something locally at the scapula and then you got to pack it. It may be that you need to design or pick exercises that promote your ability to put air into the front of the thorax, and maybe that makes a much better impact on that.
Awesome.
Yeah, long story short, pack suitcases, not shoulders.
Boom.
Got it. Perfect. Yeah. You had mentioned a little bit ago, if you're having somebody, you're going to pepper them with things contrary to like this whole the tension emphasis that's required for, let's say, hardstyle kettlebell. What are some of the things you would give like a general pop or a kettlebell practitioner that could help kind of offset that constant tension that they're looking to generate through their kettlebell skills?
Yeah, it depends on the person's goal, but
of course,
most of the people who I work with, Getting, I think if you can get someone to get a full squat and perform all of the tasks needed to chase that goal, that's going to do wonderful things for creating movement deficit or restoring movement deficits that we commonly see with most people. Most people, based on their internal anatomy and the structures that we talk about, if they are going to restrict movements, it is because the way that they're dealing with those variables, their genetic structure, the internal organ asymmetry, and some of the environmental stuff that they choose, the tendency is to push the center of mass forward and to the right. And this has to do with, again, hard on the left, liver on the right, and the way our body has to accommodate those tissues moving within us. And so what I try to do is work people back the other direction. So I try to pull their center of mass backwards and sometimes to the left, depending on the degree that rotational element is involved. A squat is your maximal expression of being able to pull your center of mass backwards. And so if you can get a vertically oriented squat where the pelvis stays more vertical, the knees are pushed maximally forward, you can go all the way down. You don't have to twist your feet out or assume a really wide stance. It's generally a good thing to chase to be able to enhance someone's movement capabilities. And so that might involve what I call stacking based drills, which are basically teaching a posterior tilt of the pelvis and then superimposing on that a respiratory strategy that helps close the lower rib cage, bring that backwards, so then they can create a multi-directional expansion both in the thorax and the pelvis. And there's a lot of videos ad nauseum on how to do that on my YouTube channel. Search Zac Cupples. So that would be one thing. And then some of the squat based drills that we would utilize would be, even coaching like a heels elevated based squat. You can start with a very supported version and then work towards more unsupported versions. And that's a really good place to be. Now in the uppers, actually pursuing a good squat can get you good changes in shoulder mobility, because in order for you to go all the way down, the posterior rib cage or your upper back has to be able to create a certain amount of motion in order to get all the way down. But I also think teaching most people to do alternating based reaching activities, not necessarily like a bench press where you're planting the scapula down in order to move weight, but allowing your scapula to slide and glide both forward and then upward and downward, as we talked about with the overhead press, and doing it single-sided, that can be really useful for improving someone's rotational capabilities in the upper thorax. And that would probably be my second thing, would be, do you have the ability to rotate in your torso? And so if you can chase those two things and keep them at a pretty good pace, you're going to have a much larger movement menu to choose from, because you have more range of motion overall available. And then once you've capped on those beginner gains and you've gotten that baseline to build from, then you can push and specialize wherever you want to go. But getting good squatting and getting good rotational capabilities will get you pretty far.
Let's get a bit more into rotation, because one thing I've noticed, you'll use an arm bar. Your arm bar is a little different than the traditional kettlebell arm bar. With hardstyle, you're really just getting that arm overhead. You're kind of fixing it there. You're going to drive the legs over and kind of use the hips as a means to lever that T-spine rotation. Can you take us through what you do, what you're looking for with your arm bar? Adding rotation, some breathing. What are you looking to do with those positions?
Yeah, so it depends on the variation that we're talking about. Let's just suppose, for the sake of argument, because this is a good starting position for most people, is I'm doing a supine arm bar. So the way that I coach it is I want my supreme clientele to exhale, and I want them to reach as far as possible towards the ceiling as a starting point. And so what that's going to do is it's going to do a few things. It's going to help assist a good lower rib cage position, because here's the thing. You'll have some people, it's funny how we've kind of moved just continually more and more towards the middle or proximally in rehab. It's like it was all about doing rotator cuff stuff in the beginning. And now it's like, well, you got to have a stable scapula before you have distal mobility. And now we're kind of in a point where it's like, well, what does the scapula sit on? Well, the answer, folks, is the rib cage. And so if I do not have good rib cage dynamics, the house is going to fall because you're not setting up a good foundation. So we want to encourage a position that promotes good mechanics in that particular area. And so getting a full reach where the lower rib cage drops, and then when you breathe in, you're creating expansion in various areas of the rib cage is incredibly useful. And so I start most people there, because then if we have the rib cage in a good position, that gives us options to do a lot of things with our arms. Now, if you wanted to bias airflow into certain areas, so say you're someone who's got a flatter upper back, and maybe you have some discomfort there, or maybe that's impeding your ability to go fully overhead. Well, what you could do is you could drive external rotation through the humerus while minimizing movement of the scapula. And so what that does is if I have external rotation of the humerus and I don't move the scap, AKA now I'm differentiating areas, not like before when we talked about with the pelvis thumping anteriorly, or I'm tilting the thorax anteriorly, that now all these areas are moving together. Now I have a situation where I'm moving joints independently and I've restored relative motion. External rotation of the scapula, of the humerus, is also going to be associated with internal rotation of the scapula. And so the medial border, so the part that's right up against the center of the rib cage on the back, is going to move away. And so what that does is that allows better airflow into the upper back. So it essentially, it's kind of like, you remember the Ding King, Billy Mays, rest in peace. Oh man.
All right. You're gonna have to explain that a little bit here.
So, what did Billy Mays sell?
Oh, Billy Mays was OxyClean or whatever.
But he also Ding King. I mean, that guy could sell anything. Might have been
hell of a drug.
It is. But so the Ding King was this thing that you put on your car and you twist it or whatever, and it would pop out dings. So if you had a dent in your car, it would undent the car. Well, if you move the scapula, if the medial border comes away from the upper back, you can actually breathe easier into the upper back because those muscles that are between your shoulder blade and the spine are more relaxed or stretched or eccentric. And so it essentially allows the thorax to move and expand more posteriorly. And here's the thing, your shoulder blade is concave. So you can see, if you're looking at it on the internet, right, it's got this space that needs to be filled. So if I can breathe into the ribs posteriorly, that can help fill that space. So now you have a good relationship between the thorax and the rib cage. And so by simply externally rotating the humerus and without having a compensatory action happen at the scapula, you can promote more air into the upper back with that particular variation of an arm bar. And there's a lot of other ways that you could encourage that as well. Sometimes I'll coach the arm bar with that. I would call that a screwdriver and also a head turn, because if I turn my head towards the side that's reaching, that will also encourage that same expansion posteriorly. There's a lot of ways you can do that. You can increase that effect even more by switching to a side-lying arm bar and then eliciting the same head turn. So depending on what you're looking for and what you need, you could emphasize this task in a lot of ways. If maybe you're someone who you get the kettlebell up pretty high, but maybe some pinching just at the top of the motion, or as soon as there's an issue that's more higher up, you might actually go with the side-lying variation, because that would actually promote that expansion effect at higher segments of the thorax and rib cage, whereas opposed to the arm bar that's more in the supine position, it's more of a lower expansion.
Very cool.
Got it. I think we call that exercise the Dean King from now on. I don't know. I mean, it's your brand, but
the Maze brand. So
yeah.
I want to do that although we should probably support his family since he unfortunately passed away.
Yeah. Well, I'll link a video to it in the description, so anybody wants to see your armbar example, as well as Billy Mays' hawking of said Ding King that I'm sure proved to be some sort of scam in the long run.
We get time for one more?
Yeah.
What do you got?
Go ahead, Roger. You hit him with the last one. I know you were so curious this morning and you were like, hey, make sure I get to ask the last question. So I don't want to run into any trouble here.
That may or may not be true. I actually do want to ask this last question because I think it's relevant to a lot of people, a lot of kettlebell folks. So you've got someone who's returning to activity after a back injury. Obviously we let's just call it some low back irritation, no real serious pathology or anything like that. What are the things you're looking for if that low back is aggravated before you're comfortable with people getting back into hardstyle kettlebell training? What are your markers, your measures? What do you want to see? What do you want to train?
Yeah. So basically what we'd want to do is we want to reverse engineer the tasks that they're talking about. So if we know that you have any type of hardstyle kettlebell based activity is going to be more hinge dominant. It means the sacrum is going to be nutating and pushing backwards, and it's going to be done so at high speeds. So to reverse engineer that, we'd have to ask, well, can you do that at low speeds? And then the step before that would be, well, can you even get into the position the way I want to, where I'm not losing motion between the joints? So if you got someone who either flexes through the spine to get down, or you got someone who does the arching the back J-Lo style on their hinge, well, we'd want to do things to fix that. And so then we break that down a step further, and maybe now we're looking at some different table testing to see if they can even get into that position. And then we would tease out as to why that would be. Generally, again, most people's compensatory bias is going to be to shove their center of mass forward and to the right. And so one of the things that I would look at for someone who's got back pain and they're getting back into the swing is, okay, so you've done this particular movement strategy. Do you have the opposing motion, which would be counter nutation of the sacrum and would be more vertically oriented squatting? So if we could get that to an appreciable depth, at least parallel, which is going to, the parallel portion of the squat actually has an internal rotation component. If we can get someone to do that, if we can get someone to do a split squat, I would say is another good precursor with good technique, because that also has some internal rotation components to it, but it's less, I have less of a tendency to do that back arch position because I'm already in a more flexed posture. And then the other thing I like to look at as a return to play criteria is if they can do like a med ball slam, because it looks like hinge mechanics, and you got some speed. Well, now you have three markers where, okay, squatting to parallel, internal rotation, split squat, looks good, not doing crazy compensatory things. They have another way of internally rotating. Now I got a situation where I'm internally rotating with the slam at short range, but high speeds. Now we might be able to introduce some hinging based stuff. And so then we can work into, okay, can you do RDLs? And maybe it starts with the snatch grip, because that has more of a flexion based component to it. And then you could work the grip narrower. You could then put that into kettlebell deadlifts. You could do, maybe like a trap bar style deadlift, which again is still more flex based. And then if you're doing all that and it's okay, then maybe we're starting to do some swings at short range. It might be advantageous to start with some unilateral based swings or anything of that nature, because I'm at least allowing some rotation to happen, and it might actually make it easier for you to express internal rotation, because you're turning the pelvis in a manner that might promote further excursion into that. And then once you've done those things, then maybe it's worthwhile trying a swing. How long is it going to take? I think it's going to be person dependent. But I think being able to check all of those boxes, being pain-free, good technique, and you can produce a fair amount of force in each of those. If you can do that, you're probably going to have a safer return to getting into kettlebell swinging, among other things.
Sounds like a plan.
That's legit. I'm going to go get right to it. I think there's like some really good quality stuff there. I know that's like, just scratches the surface with what you've told us through this whole thing. And that's why I encourage anybody who watches this to take that human matrix course and really get a good grasp on it. I mean, initially, as somebody, who's in the fitness industry, if you're a coach watching this, get in there, dive into it a little bit, and it's not going to seem as crazy complicated as you think. Zach does a great job of making it really understandable for you, even for a guy like myself. So it's super beneficial. And I love those little tips there at the end, especially as far as like being able to, get into the right positions. I think that's underestimated. And I, for one, have been somebody who's been in that position where I'm like, screw it. I'll grind through this. And it wasn't until you start to actually take, as Roger says, patience, and get more accurate with it, do you really start to see the huge benefit of your movement capabilities. I think that's wonderful stuff, Zach. And, we could go on for hours, but I will honor your time as will Roger, and maybe we'll do this again. But before we go, make sure you let everybody know who's watching how they can get at your stuff and where they can find you, and make sure they sign up for your newsletter.
Yeah. So the place you want to go is zaccupples.com. That's ZACCUPPLES.com. You're going to get access to a lot of the content that I'm talking about. We really get into the weeds here with a lot of the concepts that we discussed on this particular podcast. I offer a free course. It's called Human Matrix Foundations, which is a really good starting point when you're getting into looking at biomechanics in this particular way. It's free. Sign up for that. And it's also required if you do want to go to my seminar, Human Matrix. And I know a lot of you fine folks are going to be seeing me here in wonderful Las Vegas, December 4th and 5th. So I'm excited for that.
Yes, sir.
So yeah, that really is the hub. And then like any of the training and movement consultation and mentoring services that I offer are there. So if you check me out on my site, you'll be able to hit me up. Otherwise, I'm also, Facebook, Twitter, Instagram, all that stuff too.
I love it. Ton of free content out there. A lot of great stuff. So make sure you dig it.
And YouTube,
tons of it.
Don't forget about YouTube. Zac Cupples.
Yeah.
Lots of
get at his YouTube. I'll link a bunch of your videos, kind of like some of the things we talked about to this video for sure. One last question. Do you always have toothpaste around? Is it for illustration purposes, or are you just obsessed with oral hygiene?
Well, I just got braces last week.
Yeah, I could tell you're getting used to them.
A little bit.
Okay.
Yeah, it really chews up the gums. The gums
Turns out
they're like the cheeks. So yeah. Well, actually, I don't think my speech is horrendously bad, fortunately. But I am way more obsessed with oral hygiene because when you have braces, food gets stuck everywhere. And so I like brushing my teeth now like 3 or 4 times a day. But the toothpaste tube I found to be a very useful analogy when it comes to talking about how we move. And I have to give credit to actually my mentor Bill Hartman for that analogy, because it's just once you see it, it's like, oh yeah, that makes so much sense. So and toothpaste tube is always there. I need to get him to sponsor me though.
Yeah, Colgate or Crest, either one. Maybe Tom's of Maine. But I figured that was the case. Having taken the course and knowing what you talk about, the fluidity of the joints and stuff like that. Yeah. But I just wanted to bring that back. Anyways, I got nothing else. Thank you very much, Zach. And
thanks, Zach.
Roger, you good?
I'm good. Great. A lot of good stuff here. Appreciate it.
All right. Thank you, guys.
Thank you.